This morning we're holding a hearing examining job-based health insurance and defining full-time work. Senator Murray and I will each have our opening statement, and then we'll introduce our panel of witnesses. After our witness testimony, senators will have 5 minutes of questions. Today I'm going to defer my questions and call first on Senator Collins. I'll then come at the end, who along with Senator Donnelly, Senator Manchin, and Murkowski have introduced the bipartisan bill to solve the problem that we're here to discuss today. Let me begin by mentioning some things that are happening in Tennessee. In Murfreesboro, Middle Tennessee State University has started limiting hours for part-time workers. This means students can no longer accept multiple on-campus work assignments, and graduate assistants might have to wait tables instead of picking up extra on-campus grant-funded research projects that would better further their careers. In Knoxville, Regal Entertainment Group, which is headquartered there, the nation's largest movie theater chain, announced last year it was cutting employee hours from 40 to below 30 in order to comply with Obamacare. According to a news report, quote, one Regal theater manager said, the move has sparked a wave of resignations from full-time managers who've seen their hours cut by 25% or more. In Johnson City, Tennessee, Pam Cox, the director of finance for Johnson City Public Schools, told a local news outlet about a year ago that her district will have to hire more people to work fewer hours. She said, quote, it'll be challenging to find people. It'll also hurt the employees, because where they've been able to work as much as they wanted in these types of positions with no benefits attached to it, now you're going to be saying, we can't let you work even though you want to, and you're good at your job. We can't give you the hours, give you the pay, because we can't afford to give you the insurance. That's the Johnson City Public Schools. So why are these things happening in Tennessee and across the nation? Well, the answer is that Obamacare requires businesses with 50 or more full-time employees to provide health insurance to those employees or pay a penalty at tax time. That penalty is $2,000 for each employee whom the government says should have been covered by an employer plan, or $3,000 for every employee who receives a subsidy in the exchange. The law, passed without any Republican support, defined full-time as an employee who works more than 30 hours a week. Strange definition, one that sounds more like France than the United States. The average American between the ages of 25 to 49 works 8.8 hours per day, or 44 hours a week, according to the American Time of Use survey published by the Bureau of Labor Statistics. The Obamacare definition of full-time is nearly 1/3 lower. Many businesses can't afford Obamacare's mandate and must reduce their number of full-time employees. The result of all this is that thousands of workers are getting a pay cut. Their work schedules are being reduced to 29 hours a week and below. This isn't enough money for these workers to earn a living. Many must take second jobs. A Hoover Institution study found the 30-hour definition puts 2.6 million working-age Americans with a median income under $14,333 for individuals and $30,000 for families at risk of losing jobs and hours. The study found that 89% of those affected don't have a college degree. 60% are between 19 and 34. 63% most at risk of lost hours are women, of which half have a high school diploma or less. These are Americans who are often working one of their first jobs, trying to work their way up the ladder. You have to start with a lower-paying job, a job that doesn't require as many skills, and hope that someday your hard work will lead to a higher-paying one. Many of these Americans are working in the service industries, such as hospitality, retail, and restaurants. We're going to hear from their employers today, but the Obamacare provision is affecting all kinds of employers. In September of last year, Investors Business Daily reported that at least 451 employers, county governments, public schools, community colleges, and universities have laid off staff or reduced employee work hours. Our public schools can't charge higher prices to cover these mandates. They have to cut special education teachers, coaches, and bus drivers. 3 surveys published by the Federal Reserve Banks in August found employers are increasing their proportion of part-time workers. There's bipartisan support for repealing this provision. As I mentioned earlier, this legislation is introduced by 4 senators, 2 Democrats, 2 Republicans, one of them Senator Collins, whom we'll hear from in just a minute, Republicans have talked a lot about wanting to move as responsibly and rapidly as we can to repair the damage caused by Obamacare. We've also talked about wanting to get results. This bill should be an important step in doing both. In fact, this bill reminds me of why many of us like being on this committee, because the issues we work on affect so many Americans. When we talk about fixing No Child Left Behind, we're talking about 50 million children in 100,000 public schools. We're talking about making it simpler to apply for a Pell Grant to go to college. We're talking about simplifying a form that 20 million families fill out each year. When we talk about modernizing the Food and Drug Administration, making it easier for Americans to access life-saving drugs, we're talking about something that affects nearly every American. And today, we're focused on 2.6 million Americans who are mostly low-income, disproportionately women, and at risk of losing jobs and hours. I look forward to what our witnesses have to say. Senator Murray.